So many times, ladies are suffering with neck pain, chest heaviness, underconfidence while wearing dresses, underconfidence because they feel that people are looking at them. Why? Because of huge breasts. Hi, I'm Dr. Preeti Pandya, plastic surgeon at Viva Aesthetic, New Delhi. Today we are going to discuss about the management of heavy breasts, and the management is breast reduction surgery. What are the problems that you can have with heavy breasts? With heavy breasts, the most of the people, they complain of neck pain, shoulder pain, bra straps making heavy marks at their shoulders, fungal infections at the bra creases, and general feeling of underconfidence with dresses or in public spaces or while playing sports. So, what is the solution to this problem? The solution is undergoing a breast reduction surgery. You must have heard about a Romanian tennis player who got breast reduction done, and then she admitted that she would have got it done regardless of whether she was a tennis player or not, simply because there was so much discomfort because of her heavy weight on the chest. So, it's a very rewarding surgery. And mind you, it's not just a cosmetic procedure. It's a procedure which increases the quality of your life, which improves your outlook towards sports, towards being in public, and grossly, it makes you more confident to face the world. So let's just walk through the procedure. Breast reduction entails removal of extra skin, extra glandular tissue, and making the breast compact, smaller, and perkier. So another thing that you get with breast reduction surgery is a natural lift. When the weight is off the breast is lifted to the position where it should be instead of where it was originally because of it having a lot of weight there. So you are a proper candidate for this procedure if you have the same complaints as mentioned before, which is you have pain in the neck, you have pain in the shoulders, there's a feeling of having a lot of weight on the chest, underconfidence while wearing revealing dresses, or difficulty in playing sports where the weight on the chest makes you feel uncomfortable. How is the procedure done? The procedure is done after a proper detailed investigation and in-person consultation. What size would suit on you? What size are you actually looking at? All this is discussed when we have a consultation with our patients. Some people want a much smaller size, some people want a slightly bigger size but smaller than what they have at present. It also depends on your natural body shape and structure. If you are petite, a certain size suits you. If you are grossly wide and slightly on the heavier side, a certain different size suits you. Once the decision is made regarding what kind of size would suit you, we decide upon the procedure. The procedure is done under general anesthesia. Before you are taken for the procedure, markings are done. Now markings are to be done in standing or sitting position. So they cannot be done when you are sleeping or under anesthesia. They have to be done before you are taken under anesthesia. Once the markings are done, you are taken for the procedure, anesthesia is given, and the procedure takes anything between 2.5 to 4.5 hours depending upon the size, and ancillary procedures done. In some cases there are bra rolls, so we have to remove those with little bit of liposuction on the sides. This helps in contouring the breast to the best possible size. After the procedure, a bandage dressing is given where a supportive adhesive bandage is applied so that the breast stays in its shape. In a day or so, we ask you to wear a compression garment or a surgical bra. That has to be worn for minimum of 8 to 10 weeks. You require that because the breasts are actually not fixed to the chest wall. They are resting as natural breasts, so you need some support to keep them at that very position. And surgical bra helps in that. There are a few restrictions in the post-operative period. Like, we would not want you to lift heavy weight, we wouldn't want you to go for heavy gymming, exercises, driving, cycling, with your too much of hand movements. So for a few weeks, you are restricted to do those things. Most important question that I get is whether it will have a lot of scarring which is going to be visible or not, and secondary, whether I can breastfeed if I have children again. Usually, The scarring is prominent in the first few weeks. Once the breast settles down in its normal position, the scars are hidden and also they gradually fade over a period of time. I won't say that there won't be any scar. You'll certainly have scars, but they are quite faded in an year or so. About breastfeeding, most of the times when you are breastfeeding, you must have noticed that there is always an excess milk production. So whatever gland you have removed, that much production will be reduced. But more often than not, the child will have sufficient breast milk for feeding. Having said that, there are a few people who are unable to breastfeed regardless of whether they have had the procedure or not. So, per se breast reduction surgery doesn't hamper your breastfeeding procedure at all. In the long run, it's a very rewarding surgery for the patient because there's a lot of confidence that you get once you have a shapely body, a shapely breast which is proportionate to the rest of the body. It is also very rewarding for the surgeon because it's not just purely a cosmetic procedure, it's not just an aesthetic procedure. You're also giving a lifestyle improvement to the patient. Seeing you happy makes your plastic surgeon happy too. So in case you have any other queries, you can ask in comment section or you can request for a personal consultation. We are always there to help you.
Thank you for watching. Please like, share and subscribe our channel.